First year of medical school was kind of interesting. I had so many ideas that, I think when I finish with med school, I'm going to be a surgeon, I'm going to be a cardiologist, and I'm going to be a gynecologist. So those were the thoughts in my mind at the time. But first year was kind of difficult to know really what I would become as a specialist. But I knew that I will be a doctor, and my focus was to get out of that crowd. That was the fear, the anxiety. How am I going to beat all these people? When you look around next to you, you see everyone is either just there to waste time, or you see some other very, very serious people and determined. So first year was a kind of a year of brainstorming. How am I going to make it? And if I make it, who am I going to be as a doctor? So I had three choices, of course, in my mind. Maybe I'll be surgeon, gynecologist, or a cardiologist. So those were the thought I had. But I had a challenge. I had a lot of obstacles to overcome before I become that. And that was just the first phase of school. So what I did in the first year is, I was with some friends that I came with from high school, and we started making other friends around, and it was a game of identifying who were the smartest people in class. And that was the way I did it. I identified among my friends and also other people that we had met there who we never knew before, who were smart. They were contributing in the auditorium. You would see when they ask questions or they answer a question from the professor. And I would talk to them. Hey, where do you come from? What some of the things that you did before, and what are your goals? So we actually we made some little small groups where we would meet, because we had a break between 12 and 2. So we had time to discuss things, First year of medical school is very kind of an extension of high school, back there. We don't do things like here in America. You have an undergrad, you finish your undergrad bachelor's degree, then you go to medical school for 4 years. There, everything was combined. So you do first year all the way to 6th year, and you have the first year is you do calculus, algebra, physics, biophysics, chemistry, biochemistry. You do math. You do English as well. We had some kind of English medical terminology. So those were the things that we did in first year. But the interesting time that really, really made me start to feel like, I think I'm in medical school now. It was the second year. Second year, that's when we started really, really studying anatomy, physiology, histopathology, embryology, those kind of good stuff. And that's the time I felt like, I think I'm going to become a doctor. I start to learn now the human body. We start to discuss about embryology, how really fertilization is done and how this little human being is growing inside the uterus and all those good stuff. So I felt good. I think at the time I felt the passion now that I think this is where I'm supposed to be. I'm supposed to be here. And a lot of my friends, we were discussing, even in our conversation just among friends, we started using medical terminology. In anything we do, we're talking, we are throwing in some medical terms, some medical jargons. It became really fun. And that's when I knew that I think I am going to be a doctor.